Okay. All right, have 1:15 straight up. Looks like the gang is all here, so we'll get going. Welcome everybody to our weekly address on things regarding the COVID-19 pandemic here in the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We will start, as always, with some opening comments, and we'll go to Bloomington Mayor John Hamilton.
Thank you, Chuck, and thank you everybody for being here again. Quick updates from the city. We had 4 weeks of no cases. This past week, we did again have a positive case. So in the 5 weeks most recently ended, we've had one positive case of employees, reminding us that we're not out of the woods yet. We are now up to 500 employees have applied for the wellness benefit. So we're pleased to see that continuing to rise, and we'll encourage our employees to do the same, continuing at that. Just sharing, I know these are updates that y'all can get, but it's, I think, important for the record to note that in the state of Indiana, we're now under 500 COVID patients hospitalized across the state of Indiana. That's a number that we have not seen since the start of the pandemic, as best I can tell. And the daily average deaths in the state are now 3 as a rolling average. And again, that is the lowest since the beginning of the pandemic. So that's really good news. We see similar progress locally. I know we'll get more details on that. On the other hand, as we caution, and I keep hearing CDC Director Walensky in my ears saying, quote, "Be humble about what we know about this virus." Quote, she in April reminded us we just always have to be humble, and Indiana continues to be. We're one of 14 states in the country that are at least 10 percentage points behind the national average in terms of how many of our residents have been vaccinated, 55 versus 65% for the country. And there are about 16 states that are actually over 70%. So we're still at some risk. I know you all know too about things like the variants, and the Delta variant that's caused England to back off its reopening, and we see that rising in the United States. So again, it's just being humble about where we are, what we're doing, and it just reemphasizes how important getting vaccinated is. So we're glad as employees do that. We're glad as our residents do that. We're glad as institutions like IU and IU Health are vanguard in getting that done with their constituencies and members. We really appreciate that. I do want to say thanks to everybody who has been vaccinated. That is keeping us safe. And if you have not, please talk to your physician, talk to your family members, talk to experts about how safe and effective these vaccines are. I know Penny Cottle may share this again, and others, but if you're vaccinated, you're not going to end up in the hospital. 99+% of the people in the hospital from COVID are unvaccinated. So stay safe. Get vaccinated. Thanks for those who have, and we'll be happy to take questions at the end.
Okay, let's next go to Penny Cottle in Monroe County.
Thank you, Mayor Hamilton, for that intro, and I support what you're saying, and just remind people too that science is about learning, and guidance and things do continue to change because we learn more. And so let me just kind of update you. I don't have a lot that's new, but our cases per 100,000 this week are at 27, and we had a 2.9% positivity rate for the week, which does keep us in that blue advisory. Today, our 7-day positivity rate was actually 1.8%. So yes, we are seeing good improvements. Over 54% of our eligible residents are fully vaccinated, and we continue to see a steady, it is slow and steady, but we do continue to see an increase in the individuals who are fully vaccinated. We have over 53% who have received at least a first dose. So it is possible that we could reach that 60 to 70% with a first dose if everyone would make a plan now to be vaccinated if they are not currently vaccinated, if they would make a plan to do that in the next 2 weeks, I believe that we could reach that 60 to 70% mark. You can go to ourshot.in.gov to find out where you can go to get your vaccination. Locally, of course, there are lots of private providers and pharmacies, but you can go to IU Assembly Hall and get Pfizer vaccine. So anyone 12 and up would be eligible for that vaccine. We are starting on Monday. Moderna Mondays, as we're lovingly calling it, at Miller Drive. And again, that's our Monroe County Public Health Clinic, and that is our partnership with IU Health and the health department. And that's just going to be channeled into normal vaccine operations. You can schedule that appointment at ourshot.in.gov. We will have vaccines available tomorrow, the Juneteenth celebration at Switchyard Park. Johnson & Johnson vaccine will be available, so anyone 18 and over. The Indiana Department of Health has, during this outbreak, purchased a number of mobile vaccine units, and they've been taking them across the state, and they will be in Harrodsburg. They will be in the Harrodsburg Community Center on June 23rd, 24th, and 25th from 9 to 6. They will have both Johnson & Johnson and Pfizer vaccine available. You can schedule an appointment by, again, going to ourshot.in.gov, and then they will return on July 14th through the 16th because they'll need to do those second dose of Pfizer's. Vaccines are becoming more available in routine places. So pharmacies, clinics, providers' offices, and that will continue. And we will reach a point where these mass sites won't need to happen because it will just be part of your routine care. So if you've been waiting, now's the time when it's super easy. You can go to Assembly Hall, you can go to one of these outreach events. It is very easy to find an appointment right now. If you need a ride, call 211. There are free rides available and they can help you get a ride if you need it. There are even some places like KinderCare and YMCA that have childcare available. So if you need childcare while you go get that, you might contact our local facilities and see if they're participating in that. Less than 1% of our cases are breakthrough cases. So we continue to see evidence that our vaccines work and that they work against the variants as well. I will remind you that getting COVID-19 is not without health risks. You can ask around if you think that you don't need to worry if you get infected, that you will just get better. Some people have very mild symptoms, and some people, even after their recovery, are having long-term health effects. So your chances of serious short or long-term health issues is far greater from actual disease than any worries or concerns that you may have with the vaccination. And the vaccine gives you that added protection against the variants that we're seeing. The Delta variant is expected to be predominant strain, and it is more transmissible and has greater risk for severe among those who are unvaccinated. The things that I will end with, we talked about this last week. The Optum site at the Armory closed at noon today. Indiana Department of Health is ending those contracts across the state, but there are still plenty of places to be tested, and you can go to coronavirus.in.gov to get a list and find a testing site for you. K through 12, higher education and other guidance continues to be revised. What has not changed is the need to isolate for 10 days if you are ill or diagnosed with infection, and to quarantine if you are unvaccinated and exposed as a close contact. Yet another reason to be vaccinated. And I will end with this request. Help our community reach that 60 to 70% vaccination rate. Vaccinate or help somebody else get vaccinated. Thanks, Chuck.
Okay, we'll next get our Monroe County Commissioner's report from Penny Givens.
Good afternoon. I just want to remind our friends out there that the eviction moratorium ends at the end of June, and that if they need help with whether it's rent or utilities or mortgage, or even certain other critical expenses, that they should seek help through their township trustee. Every single resident of Monroe County lives in a township, and they can get help. We've made additional funds available, but get there before it becomes too much of a problem. If you're facing eviction, I suggest that you contact the Housing and Eviction Prevention Project. I'll put contact information for that into the chat for everybody, but it's better to avoid eviction at any cost. So we want to make sure that people are safe. And finally, the county meetings that we have, all our different commissions and boards, will go to a hybrid type of meeting starting July the 1st, unless the governor extends the current health situation. So we will be back in person for many of our things, but we encourage anybody who wants to attend virtually to do that. It'll keep us all safer. And we look forward to continue to see people. We've seen a lot more people show up as we've been virtual, which is amazing to all of us. And so we continue to encourage people to do this safely. So thank you.
All right, next check in with IU Health and Brian Shockney.
Thank you, Chuck, and thank you, everyone. Mayor, I appreciate your words. Be humble. Yes, that is how we should treat this virus all along. I do appreciate that. And Penny, Moderna Mondays. I mean, how many would be able to tell their grandchildren and children that they got the vaccine on a Moderna Monday? I mean, how good is that? So take advantage of Moderna Monday. I love it. There is a blood shortage across the United States currently, and so we encourage everyone that can give to go out and give blood. There are many locations that you can do that. Just go out to all the blood centers in the state of Indiana, and there are others posted in different healthcare facilities, but we are experiencing a critical blood shortage currently. Over the last few days, we've seen continued decrease in the number of COVID inpatients in the South Central region. This is terrific news. Here in Monroe County, it's the same story. We continue to see this gradual decline of inpatients, people who are sick enough to be in the hospital. As we see increased numbers of vaccines, even though not as high as we'd like, our hope is that we will soon be able to share that we have had days with no COVID-19 patients that are seriously ill and requiring inpatient care. We are longing for those days. As I mentioned last week, we celebrated the last vaccine at our Bloomington Medical Arts building and our community vaccine site. And we are once again grateful to our team members and the hard work of the volunteers that made this contribution to be successful in this vaccination of our community and the communities surrounding us. We will no longer have weekly data to report on vaccine numbers as we hit over 90,000 total. But that will be reported on the Indiana State Department of Health website. As Penny mentioned, the opt-in testing site will be closing, and across our IU Health region, we're establishing testing capabilities in a number of IU Health Southern Indiana physician, adult, and pediatric offices. This will continue to ensure those that are sick will be seen in their primary care offices and can still have access to testing. These sites will also be offering the vaccine in the coming weeks, and we will share additional information of all these sites on our website where you can go to get tested, as well as where you can go and get your vaccine. As community health team continues to their outreach efforts in our communities, they continue to reach out to different venues and different locations and celebrations to do that along with the health department, Penny Cottle's team. So for those of you who know me, I'm a big National Day fan, and today is National Wanna Get Away Day. I bring this up because getting a vaccine means we can more freely celebrate our families, our friends, and our adventures together. Hopefully, as our state and country continue to open up more after this pandemic, you have seen that we are able to get away, or we're planning to do so. We are still experiencing the highest mental health needs in our region. These needs are above and beyond anything we've experienced with IU Health in this region before. And the safety of all of us is important. So celebrate National Wanna Get Away Day by going and getting your vaccine. It's the safest thing you can do, and you can celebrate and go wherever you want after you are safe. So not just today, but every day should be your National Want to Get Away Day by getting your vaccine. As I close, I would be remiss to just recognize those of us who are celebrating Juneteenth. It was on June 19th, 1865, that Union troops arrived in Galveston Bay, Texas, and announced that the state's more than 250 enslaved Black people were free by executive order. And we are very grateful for our current U.S. Senate that unanimously approved a bill to make Juneteenth a public holiday. And this bill now goes to the House of Representatives. So join us in celebrating this Saturday, June 19th at Switchyard Park. I will take questions at the end.
Okay, let's next check in with Indiana University and Kirk White.
Well, good afternoon, everybody. It's a pleasure to be with you today and give you some updates from the campus. Our vaccine clinic at Simon Scott Assembly Hall continues. It's a good, aggressive, and comfortable vaccine environment. We're up to 38,900 doses that we've administered at Assembly Hall, and we still have plenty of appointments and walk-ins. So you can just pull in off the bypass, park your car easily, drop in and out. It's probably a 30-minute process at the most, and that includes the 15 minutes at the end for observation. So plenty of capacity out there, and we're very happy to welcome you. As was mentioned, we're now the remaining mass vaccination site, and have been pleased to partner with both the hospital and the county over the past months of vaccinating folks and making them available. And we're pleased to continue that now on the campus at Simon Scott Assembly Hall. So come by, it's easy to do, and we'll be ready for you with a smile and a nice view of the Assembly Hall floor. Mitigation testing at the campus continued this last week. The week of June the 6th, of the 1,619 people that were mitigation tested, we had only one positive test result, and this week so far only one as well. And it's a small number of mitigation tests compared to where we were, but remember the campus is a lot smaller right now in population, and all of our students, faculty, and staff who have been vaccinated are no longer in the random mitigation testing pool. So these are just the folks who have either come by for a voluntary mitigation test or have been called in our normal testing rotation for those not vaccinated. So we're doing very well in terms of infections on the campus. Our vaccine incentive program is now completed its second week, and we're giving out those prizes that we've been so happy to be able to announce. And then to remember, this goes on for another couple of weeks. On July the 2nd, that grand prize for a student will be 1 year of in-state tuition. And we look forward to awarding that. That'll be an exciting day. On the campus, with the great success we've had with low infection rates and really continuing week by week increasing vaccination rates, this has allowed us to continue our plan back to normal operations for the fall semester. And so you'll see on campus, our facilities staff is busily working to reset all of the classrooms back to full capacity, getting seating back in place, getting things spaced out properly so that we can be back to full in-person education, instruction, and research as we get back in the middle of August. Speaking of getting back to the semester, this week we're starting to welcome some of our pre-freshman groups in town. So we'll see a few hundred extra students arriving early to get prepped up for fall. And of course, they're going through our normal mitigation testing and vaccination processes as well. And let me just close by thanking our friends and partners over at IU Health. On Monday, university delegation was very pleased to participate in the initial flag raising ceremony on Flag Day this past Monday at the new Bloomington Hospital and Academic Clinical Center site on the 4546 bypass. So we appreciate that invitation. We've raised the state flag, the U.S. flag, the IU Health flag, and our delegation got to raise the IU flag on this great new site. And this will only add to this increased public health atmosphere and availability in our region. And we're very pleased to be a part of that. So thanks to our good friends at IU Health for allowing us to participate. Thank you.
All right. Thanks very much, Kirk. We'll go into questions. First one from Dave Askins, the B Square Beacon. For Penny Caudle, how many doses of Johnson & Johnson vaccine will you have on hand at Switchyard Park on Saturday? If demand turns out to be super high and you can't tell early in the day that you're probably going to run out, is there a backup plan for getting more vaccine?
Dave, you always ask the tough questions. And of course, that would be a question our nurses would have the exact answer to. And I am trying to get you a specific answer. But I can tell you that if we are extremely busy and we need to make another plan, we will make, if people are wanting Johnson & Johnson and they are there, we will, if we have to take names and make a wait list and make other arrangements, we will do that. And if before we are off of here, if I have an answer to that, I will share it with you, but I do not have that off the top of my head.
Okay. Next question for Brian Shockney from Dave as well. At this point, does IU Health have any areas in the new facility on the bypass set aside as a special COVID-19 ward? And is everything still on course for the move later this year? There are other parts of this question I'll ask after you take on that part.
Yeah, so the new facility is prepared for that. We had been preparing from an emergency management standpoint for that in a few ways, but we have fewer entrances. Our acuity adaptable rooms keep patients in their rooms rather than having to move them. So we bring the higher levels of care to them as their care progresses. So that's safer. And we have the highest number of negative pressure rooms, and those are those negative pressure air rooms that we require for all infectious disease patients. So we have many of those where we had to do some makeshift in the current hospital and cut out windows to put in devices in the rooms. We will not have to do that because we have so many of our rooms that we've converted through this construction for a negative. As far as the clinic space, the front part of that building, the 3 levels there are built out as clinic areas. And so those can be utilized as COVID clinics, walk-in clinics, all of those in any pandemic situation.
Yeah, and I think you answered basically the second part of this question. Is there anything specific about the new facility that would make you say if we were hit with another pandemic similar to COVID-19, the new hospital would put us in a better position to deal with it? Sounds like the answer is yes.
Yes, it would. We've been able to pivot on many things. Unfortunately, we had a pandemic, but the timing of the pandemic was good for us because we were not complete, we were just putting walls up at that time inside in the interior. So it allowed us to pivot on some things that really make it better for us. Our entrances and exits, our flow of air, the PPE even, instead of having our PPE in the hallways, it's now built into the walls and cabinets where it's safer and we can get to it. And every room has it instead of where we have now. We have carts and all kinds of bags and things we have to carry up and down hallways and put in hallways depending on where the patients are. And we no longer will have to do that. So I wouldn't call it a gift, but the pandemic has taught us and showed us several things that we have been able to transition. Some of the things we'd already planned for and some we were able to transition.
Okay, don't have any other questions in the chat right now. I'll buy a little time by going to my friend Kirk and ask him a question here, just to elaborate a bit on how things are going with the vaccination at IU or after the requirement has been announced. How do you feel about what the vaccination rate is right now from what we know?
Well, what we know is that little by little, more and more people are getting vaccinated, and they are submitting their documentation. And so this is a really positive sign. As I mentioned last week, we hope by the end of next month, certainly, to really get to that 70% level. Our faculty and staff seem to be adopting a little faster than students, but that's to be expected since the student population may be scattered around the country at the moment and not have the same access that so easily done here in one place at Simon Scott Assembly Hall. So progress is being made, and this is a good thing. I can say that we're frankly using every tool in our toolbox to encourage our students, faculty, and staff to get the vaccines, and not just for the Bloomington campus, but this is for all of our campuses statewide. We're reminding them how easy it is, giving them the links to make an appointment or find a location, and letting them know that that there's plenty of resources that we have available and on our websites about the efficacy and the safety of the vaccine. It's really great to have the resources of one of the largest medical schools in the country and our distinguished faculty that have advised us on this. And I trust them. They're Hoosiers, and they have our best interests in mind to advise us on the best courses to take. And I think the kinds of the kinds of information that particularly Dr. Aaron Carroll and Dr. Alana DeVebo have been able to provide have been really encouraging for all of us, and will continue to be as we continue this fight through the vaccination pandemic, or the COVID pandemic.
And I'll put out one more call for questions, give you a few more seconds here to get one in if you have one. Mentioning Aaron Carroll, I'll put in a plug for our own product. We have restarted summer editions of the Ask Aaron webinars Wednesday at noon, which you can register for. That's a good place to get not just questions that are specifically focused on IU situations, but also COVID in general. And you can find a link to that at the covid.iu.edu page, as well as the link to the past editions of that. Again, that's Wednesday at noon. These are fresh shows. They're not summer reruns. So I do encourage you to tune in. Mayor Hamilton, you have something?
I know we may be closing, but just a reminder, adding to that Juneteenth celebration, it's going to be a big day at Switchyard for those who want to go there from 3 to 6:30 p.m. Get your, I don't know if it's a J&J Juneteenth or what's the vaccine out there, but please join in the celebration of that, and all are welcome. Free food, by the way, I think.
Ooh, all right.
During a Monday and J&J Juneteenth. It can't get better than that.
All right. Well, seeing no other questions, we will end it there and plan to see you again next Friday at the same time. Thanks for your questions, and see you next week.
Have a good week, everyone.